Hey guys, it's Dr. Arianna, and today I want to talk to you about the difference between ThermiVa and Mona Lisa Touch. So I get this question a lot, and I wanted to hopefully put some of them to rest. So as you know, I spend a lot of my time doing vaginal rejuvenation. Let's first of all be clear on what vaginal rejuvenation is. We are not trying to create new vaginas. We're not doing really anything extraordinary. To rejuvenate means to bring back to its youthful state. So all we're doing is really treating the tissue so that it has more collagen, elasticity, and that it behaves, so to speak, a little bit more like it did when you were younger. So with that said, why do we do vaginal rejuvenation? So the top reasons that patients call and really need help are urinary incontinence and vaginal dryness that causes pain with intercourse. And then another very common reason is that women, as we age, they just feel more laxity, and they've had a couple of kids, so it's a very normal thing. Again, all we're doing is trying to restore the tissue back to its natural or more youthful state. That said, there are different modalities to do that. So one way, and it's certainly not the only way, but is to try a vaginal rejuvenation type of treatment. What does that mean? We're going to use different types of heat to basically micro damage or injure the tissue, or to otherwise change what's happening so that the tissue now starts to build more collagen and have more elasticity. So we can do that a variety of different ways, but the two most common ways that we're going to affect the tissue, the vaginal tissue, is through radiofrequency is one, and CO2 laser is the other. Now, why would you do one versus the other? First, let me explain the differences. Radiofrequency is going to use that radiofrequency heat, and it is going to go very deep into the tissue, and depending on the machine that you are using or the person's doing the procedure on you, it's going to go as deep down to the level of what we call the muscularis, the muscle, the pelvic floor. These treatments are typically done in a series of 3, and typically they're going to be about 4 to 6 weeks apart. Now, we like this tool in particular because we can really help to stimulate collagen deeper in the tissue. And so for women who have things like urinary incontinence, this type of heat can be a very effective treatment. Again, it depends on the type and the etiology, the cause of the urinary incontinence. Some women get urinary incontinence just because their tissues lack estrogen and that elasticity, and so that same tissue lines the urethra and some of the bladder, so they get dryness in the vagina, but it also impacts what's happening in the urinary tract system. But other women have urinary incontinence because of literally the angle of the urethra and how it changes with coughing, sneezing, jumping. Funny thing is, I have a lot of moms, 30s and 40s, that say, yeah, I get I leak urine when I jump on the trampoline. And I'm thinking, well, just don't jump on the trampoline, I guess. But you know what? For some reason, trampolines are very popular, and moms want to jump on them with their kids. So I get a lot of that. So in any case, we love using radiofrequency heat to get deeper in the tissue, and I love this tool. Actually, the one that we use here in the office is called ThermiVa. I actually have a few radiofrequency devices, and they all work great, but ThermiVa was the first one that I started with, and I still really like it. Now, it has some pros and cons, but more pros. And what it's able to do is we take this part of it, the heating element, and use it inside the vagina. It doesn't hurt. We use like a ultrasound type gel, so it's really kind of like you were getting like a vaginal ultrasound if you ever had one of those. It doesn't hurt. You can see how small it is, and finger. So it's really a very I wouldn't say it's a comfortable procedure, but as procedures go, it's pretty low on the list in terms of any discomfort or pain for sure. It takes about 20 minutes to do an internal treatment, but what I love about this is that we can also treat the outside of the vagina. So we can stimulate collagen and elasticity in that tissue as well. And that's what women want, right? After a while, it just, starts to get a little saggier. And so we're just able to plump it up and tighten up the tissue. Nothing artificial, nothing, that's not yours. It's just helping your tissue behave a little differently. That is radio frequency. The other treatment or heat mode that I was mentioning earlier is CO2 laser. Now, there's a lot of devices out there, and I know it can be confusing for consumers, but the device that I use is a Mona Lisa Touch. It is probably, I want to say it's the gold standard for vaginal rejuvenation in the CO2 laser world. And we're using applicator, something like this. This is it actually. And basically this is connected to a long arm, but the part that you will be familiar with is this. So as you can see, it's a little bit bigger in diameter going in, but it's also, believe it or not, it doesn't hurt. Who knew that it doesn't hurt to CO2 your vagina? So quick story, I went to do the training for this several years ago, and I'm in the room after we've, learned all about the science of it and the physics and all that of laser. And so they have these models there that are going to, be there as we do the procedure and watch it being performed. And I remember this so well. He went to go put this in, and I'm kind of like, so when are we going to numb her? And they're like, oh yeah, it doesn't hurt. And I'm thinking, okay, let's see how that's going to work. And sure enough, and as we do the procedure, all we're doing is going around in this kind of circumferential fashion and going from the top of the vagina and coming all the way out. And basically, we're just kind of getting all the vagina out and just little bursts of energy. And I'm like, oh. And I don't have a high pain tolerance, so that's when I tell people something doesn't hurt. I promise you it doesn't hurt, because I don't do pain. And I've had all of these procedures done. And it can be uncomfortable, like especially if you have vaginal dryness and you're putting something in and it's just uncomfortable. I've had women, they haven't had intercourse in years, so it's kind of like, yeah, it's going to not feel great. But over time, they tolerate the procedure much better. But anyway, getting back to the Mona Lisa Touch. These treatments are done, it's actually a much quicker treatment. This is ideal for women who have vaginal dryness and pain with intercourse. Like if your only symptom is vaginal dryness and pain with intercourse, as a result of that, this is a perfect tool. Now, of course, I like to combine them because more is better when it comes to vaginal rejuvenation. So that said, I like to do this for the kind of superficial atrophy of the vaginal tissue, and I like this one because it's going to deal with the superficial, no doubt, but it's going to go deeper, and it's going to help a little more with firming and just helping with that laxity. And I can also use it on the outside of the vagina. You could use CO2 on the outside, but you're not going to see any difference. So, and the reason why I ended up getting so many of these, I call them my toys, is because I started out with one, which was the ThermiVa, and then I realized, I had one hammer, and there's a few different types of nails here. So this one is really my all-purpose one because I can use this really for anybody. This one is more limited for people who only have dryness, really. And it's a much faster procedure. It's less expensive. It's less expensive for the patient, and it's less expensive for me in terms of what we call the consumable. So there's all different reasons, but I just wanted to be able to, whatever the situation was, be able to provide the best treatment for the patient. But that said, I also realized that it's great when you combine things. So, and I can't say any of it is necessary, but I can say that I've had some great results. I had a patient today, as a matter of fact, who's in her late 30s. She was complaining of laxity and just not as much sensation. She had some urinary incontinence. So she kind of had the whole kit and caboodle, and we did ThermiVas on her. After her first treatment, she basically had over 50% improvement. She's like, yeah. Quicker time to climax, or less time, more sensation, more lubrication. She felt tighter. She just felt it more. And so that's what happens, like during childbirth, labor, whatever, things stretch out and they don't always bounce back so much. So again, if you are, starting to notice some things that are changing, you're in good company. Vaginal dryness is like one of the best kept secrets of perimenopause. And I have so many women who are like, but they didn't tell me this was going to happen. I'm like, I know, right? But here we are, and it's okay. There's a treatment for it. Now, there are definitely other things that can be done. Lubricants, vaginal hormone replacement, systemic hormone replacement. I'm not saying this is the only way for you to get that result, but it is a wonderful way, as one of my patients said, to just wake up the nerves again down there and, really start to touch base again with what's happening. And so for some women, they just start to get a disconnect there. And that's exactly what one of my patients said. It's like, I feel like my brain and my vagina are connected again, which I thought, oh, I like that. That sounds good. We want our brain and our vagina to be connected. I.e., we want to feel good. And so often, I hear this more often than not, women are literally like, I'm just doing it because my husband, I know that if I don't, it's not going to be cool. And I'm like, yeah, but you don't have to suffer. Like, that's kind of not what it was designed for. So, you don't have to suffer. Know that there are tools out there. There are therapies and ways that we can help you. So, hopefully I answered some questions for you. Feel free to reach out. I'm at drarianna.com and tulawellnessmd@gmail.com if you have questions. Also, come check us out here at Tula Wellness. We're located in Tucson, Arizona. And I have any array of toys in here. We can do aesthetics, hormone replacement, vaginal rejuvenation, a little skin, body contouring. We've got a lot of things to uplift women, help you feel your best in any season, but especially in that second half. That's what I'm here to help you with on this journey. Thank you again for watching, and hopefully I will see you guys soon.